On this challenging night, I began my shift, only to discover that two nurses had called off. We have been understaffed for a while now, and every time we inquire with management about the situation, the response is always, "We're working on it," or "We just interviewed some potential candidates." Unfortunately, it seems that every new hire either quits just before their orientation ends or within the first 2 weeks of working independently. That evening was particularly memorable. I had a new patient who insisted on sitting in a chair all night, fearing that if he lay down, he might not wake up in the morning. He arrived with cold, congestive heart failure, had previously undergone a kidney transplant, and depended on a CPAP machine and supplemental oxygen. Caring for 8 acute patients under these circumstances felt overwhelming. I prayed to God for calmness, strength, and protection for my nursing license. Throughout the night, Mr. Smith, one of my patients, was on the call bell constantly, making the shift feel 10 times harder. I must have walked what felt like 20,000 laps, but I wasn't wearing my Apple Watch that night to track it. By the end of my shift, I staggered to my car and collapsed for about 30 minutes before regaining my strength to drive home. Nurses work tirelessly, and it's crucial for management to support us. Planning ahead for call-offs is essential. Having enough PRN staff willing to cover shifts is critical. Offering incentives to encourage other nurses to step in and hiring on-call nurses would significantly help. Most importantly, frequent appreciation of your full-time staff and fostering a teamwork environment can make all the difference in our demanding work life. This is the reality of nursing, and I look forward to sharing more of my experiences.